Urgent care clinics are out there, but do you know when you should go to the emergency room and when you could just go to an urgent care clinic instead? Or when it may be more beneficial to visit an urgent care clinic instead of your primary care physician? It depends on your symptoms, and you may be surprised to know that your treatment time and how much your doctor's visit costs you are all affected by the facility you choose.
If you've been to the emergency room lately, you probably experienced a pretty long wait. Doctors tell us many of the patients they are treating in the ER do not have life-threatening emergencies, and that is what's contributing to the backlog. Now, new healthcare partnerships are being formed to relieve overcrowded emergency room conditions.
Not cost effective, there's long waits, the emergency department's geared for the major emergencies, and so sometimes those with the minor emergencies, earache, sore throat, kind of get pushed to the side while the bigger patients got dealt with.
So people are already coming here for health care, and so adding that urgent care component really filled a void that we felt was not being met at this specific location.
The average time patients wait to see a doctor at an emergency room in Alabama is 30 minutes. That number doubles at Providence Hospital. The average wait is an hour. With this new partnership, there's hope those wait times will soon come down.
Hi, I'm Dr. Lamb, and I'm an urgent care physician here in Centera Urgent Care in Gloucester. In the urgent care setting, patients usually come in when they are feeling ill, sick, or having an injury. Most of the time, people try to get in to see their primary care physician, or they might even go to the emergency department. What we try to push here is anything that's not an emergency or life-threatening can be seen or taken care of here. Kids, adults, seniors, we see everything from common colds, illnesses like sore throats, earaches, flu. People will have injuries, fractures, which means they break bones, or lacerations where they need repair. And we also treat a lot of skin infections, bladder infections. That can be taken care of in an urgent care setting where it's not life-threatening. We can repair all those injuries. We could take x-rays here in the urgent setting.
As an architect, I say a recovering architect, I can imagine a future where people are healthier. I can imagine a future where the planet is healthier. How do together people in the health professions, people in the design professions, people in politics, activists, others, make that vision possible, and what are its parameters? What are the specifics that you could imagine on 3D?
In addition to my law licenses, I have a certificate in healthcare facilities planning and design from the Sloan School of Health Administration at Cornell University. That was something that I felt it was important to pursue because I had taken on the drafting negotiation of all the commercial lease agreements and all the outreach license agreements for the University of Florida College of Medicine, and in doing that I really started to get interested in seeing the different floor plans and layouts and intricacies that go into that. And the course that I took prior to getting my certificate in the healthcare facilities planning design really focused on the strategy behind that. It was phenomenal. It was very eye-opening to see how the way you design a building and the flow from nurses to the reception to the patient outtake, intake can affect the patient's experience.